Hello, my name is Dr. Leonard Hess. I'm a faculty member of the Dawson Academy. I'd like to spend a few minutes with you talking about bruxism. Everybody always asks, what is bruxism? And it's basically just a fancy word for when you're grinding or clenching your teeth together too much and too often. Next, let's talk about the signs or symptoms of bruxism. And there are four very common signs or symptoms that most people can recognize in their own mouth or in their own head or neck. A very common thing would be broken teeth. If you are putting excessive forces on your teeth in a way that they're not designed to handle, then it's very common for you to experience broken teeth or stress fractures in the teeth. Even though our teeth are the hardest substance in our body, eventually they will wear down or break. Another common thing would be sore muscles. If you're overworking your jaws at nighttime, your muscles will become fatigued and you'll wake up in the morning with sore muscles or tired muscles. In addition, you may wake up with headaches or feel very tight on the sides of your head. Worn teeth would also be a very common sign or symptom. If you're again playing with your teeth or excessively rubbing them together, you may notice that your back teeth are becoming flat and that your front teeth are becoming short. And this can become a very complicated problem and can often feed on itself and make the problem worse over time. And lastly, TMJ issues could also become a sign or symptom of bruxism. Clicking or popping or pain in your joint, these aren't normal and oftentimes will be a sign or symptom of a larger problem. Okay, now that we know signs and symptoms, let's talk about treatment. Any treatment would begin with a complete examination. And the reason for that is that a diagnosis must be made. Your doctor must determine what's the source of the bruxism. Why are you grinding or wearing your teeth excessively? Could it be from a central nervous system problem? Perhaps it's that your teeth aren't quite fitting together as harmoniously as they could, and that causes some muscular issues or some joint issues. Maybe the problem is related to your joint. All this must be determined so that the proper course of action can be followed. A few options for treatment would be perhaps only a night guard or a splint. If your teeth are lining up properly and your joint is healthy, then it may simply be that your brain is programmed to want to play with your teeth or grind your teeth excessively. And in that case, something must be fabricated to at least allow protection of your teeth. Another option may be orthodontics. Perhaps your teeth aren't quite in the proper position spatially that when you are chewing or when your teeth are functioning, they're allowed to rub against each other in a way that they're not supposed to. Another option may be a bite correction or equilibration, and that's where small adjustments are made to allow your teeth to fit together harmoniously, allowing your muscles in your joint to be in their proper position and to allow the system to work like a spoke or a cog in a wheel, allow everything to fit together properly and function in a more harmonious fashion. And another option may be restorative dentistry. If you have ground or worn your teeth to the point to where the natural shapes and contours of the teeth are now missing, and you have exposure of layers of your teeth, in that case, it may be necessary to actually perform dentistry to allow restoration of the proper contours and to also give your teeth that pretty beautiful, healthy smile again. Bruxism is like any other health issue. The earlier it's caught, the more conservative the treatment can be. That's why if you are experiencing or recognizing any of the signs or symptoms of bruxism, seek out the help of a qualified dentist as soon as possible. The long-term ramifications of ignoring bruxism are quite great. They would include loss of natural tooth structure, possible damage to temporomandibular joints, and muscular discomfort. Not only do these problems decrease your quality of life, but they also make treatment more complicated. And the more progressive the disease is, the more limited the treatment options become. Well, I hope this has been a help to you, and I hope you have a great day. Thank you so much.